My name is Dr. Jane Goldberg. Welcome to my show, Musings from 20th Street. I am a psychoanalyst, and I am the owner of La Casa Day Spa, which is a holistic day spa on East 20th Street. Today is the 37th session of my Really Real Reality group therapy show, and I thought I would begin today by telling a little about this patient who she's an unemployed architect, and she's thinking about whether or not she wants to continue with architecture. She is in my private practice, and so she decided to take a course at the Psychoanalytic Center where I'm on the faculty. And she asked me, but since she's unemployed, she doesn't really have a lot of money to pay for the course, so she asked me if I would write a recommendation for her so she could get a scholarship. And as I was writing it, I found myself saying about her that she was a talented patient. And I realized I'd actually never thought about a patient as being talented, but that she did qualify to be a talented patient. She really got what the work is, and she cooperates with the work, and she's doing the work, and she's making great progress, and we're having lots of fun with it. So I started thinking about talent as a patient, and then I thought about that TV show, the Next Top Model, or all those shows that do that. And so then I started thinking about these patients in this group that I have here. And at the end of this America's Next Top Model, the host, I forget who it is exactly, Beyonce maybe, she goes through each person and she kind of gives an evaluation and says, well, this is who you are, and this is how you've grown through this process, and this is what you still need to work on. So I thought I would do that with these patients in this group therapy that we've done. So I'm going to begin with the dead patients, the metaphorical dead patients that are no longer with us. I think the first to go was Regan, and I thought, obviously if they're not here, then there's an issue with commitment, because everybody did begin the process with giving me a 16-week commitment, and if they're not here, then they didn't honor that commitment. So that goes without saying that there's a commitment issue. But for Regan specifically, I think that I thought that she had a lot of growth while she was here, and that she was getting increasingly clear with a kind of characterological lack of clarity or kind of fuzziness, which I think was centered around the fact that she didn't always know what she was really feeling and didn't have the courage to actually say it lots, even when she did know it. I think the next one was Andres. Andres, in looking back over the tapes, I realized that the last show that Andres was here, I pretty much declared my love for him. There was a whole little tete-a-tete that we had where he said something about how I felt, and I said, don't you know how I feel? And he said, yes, I guess I do. And so I think Andres may have an issue, and thus in not coming back to the next session. Maybe Andres has an issue about not wanting to be loved so much, and maybe that had something to do with why he decided to break his commitment. Then we had, just briefly, we had Adrian. And Adrian seemed to be needing and wanting to mourn his dead mother. And I thought maybe Adrian actually couldn't participate enough in the world of the living and was staying too much in the world of the dead. And it would have been good for him to stay here and resolve that. And EJ, I think, was the last one. EJ, the last time he was here, he said he had broken his commitment, and then he had a conversation with his sister and decided to honor his commitment, but then broke his commitment again. So obviously commitment is the biggest issue for EJ. And now I'm going to talk about the alive members that are still with us, and I'm just going to give my kind of thumbnail sketch of who I see them as being and what this process has meant to us. Because we're in the 37th session, we actually are coming fairly close to the end, which would be 48. So we only have 11 more. So I thought we might want to spend time kind of evaluating and getting closure on what this process has been. So the first person is actually a new member. I'm going to start from the right. This is Shanti, and I don't have so much to say to Shanti, not knowing you really in this capacity. But I would say you seem to be fairly courageous and brave to enter this without knowing very much about it. And so we'll learn more about you. Kay, I've really admired your forthrightness and your ability to know where you are and to be able to express it. I do think, however, that you still have unresolved issues about the trauma of fear and danger. Because when you were so terrified about Walter, that he really was dangerous, I think that was not an accurate appraisal of reality. I think he's not dangerous. So I think there's still some stuff that you can work on with that. But all in all, I think you've done fantastically, and it's been a joy to have you.
It's been a joy to be here. Thank you.
Walter, your issue seems to be you can cooperate, you just don't want to sometimes. So there's a real kind of obstinance in you about that. When you decide you want to cooperate, you're fine. And you're going to cooperate with me right now by not talking, because I want to finish going around, and then we can talk about everything, including whatever your reaction is to what I'm saying about you and about everybody else too. So John, you also haven't been with us all that long, so I'm not sure I have a whole lot to say about you. But I have noticed that you really live in your head a lot. And when you allow yourself to stop with your thought chatter and really allow yourself to process what you're doing on an emotional level, you're right there. But your thought chatter does kind of absorb you a lot. So I think that's something that you're going to need to work on. How am I doing as a
Great.
as America's next top patient analysis?
America's Got Talent. We're right here.
So Carol is next in my list. Carol, you've been amazing in looking at the beginning of the tapes, and then I think it was last week when you told the whole story about coming to your aggression. We of course, what I began to notice about you first was everybody loves you, and nobody has any negative feelings toward you whatsoever, and that's kind of not normal. So I began to get interested in that question, and then we started addressing it. And do you have any negative feelings? And should we have negative feelings toward you? And as a result of that exploration, you came to know that what happened to you in the salon a couple of weeks ago, that you really did have some angry feelings about it, and you really stood up for yourself, and you took the time to tell us the whole story from beginning to end, and it was just fabulous. And I just love the growth that whole episode kind of represents in you.
I appreciate it too.
Dee, this is what I want to say to you. I'm wondering, you seem to have come into your own a lot. In the beginning, you were really quiet, and now you really are a very strong member of the group, and you have a lot to say, and you have great conviction, and that's really lovely. But I think that at times, loyalty may be your strongest suit, and it may actually dominate from really knowing what you're feeling. And the reason why I'm saying that is because there are times when it would be appropriate to have negative feelings toward the group member that you seem to be having this love affair with, Barbara. And yet, no matter what she does, you're always supporting her.
Yeah.
But you do need to be in touch with what I call induced feelings. If somebody is acting in a certain way, and a large number of people have the same reaction, it means that they're exhibiting something characterological about themselves. And Barbara has a very strong character, as we know, and I think she said right at the beginning of the show, you either love her or you hate her. There are times when it's appropriate to be irritated with her, and I do think that you need to forego loyalty sometimes in order to allow yourself to have that emotional experience. Barbara, last on the list. So what you're doing right now, for instance, this is a forum in which you are here to talk about your thoughts and feelings, to not act them out even though you're staying in your chair, so you're following the rule on that count. But it's also to not demonstrate what you're thinking and feeling, but to verbalize what you're thinking and feeling. And I think the thing that you do that most interferes with that process is talk. I think you really need to listen better than you do. So that's what I want to say. That's my intro, and let's see where we go with all that.
Why is it I never hear anything positive about myself when I go to these groups? It's almost like somebody, I feel like I'm back home with my parents.
I can answer that.
Because that makes me feel
I can
worse.
answer it. Do you want me to answer it?
Yeah, go
Okay.
ahead. Go ahead. Just
Okay, well, you have to stop talking enough for me to answer it. That's the reason. The reason is because you talk so incessantly that you don't allow people to come to have their positive feelings toward you. You know, I talked either last week or whenever, I talked about emotions being like food, and that you have to allow people to have the experience of being hungry for you. You're overfeeding everybody all the time, and when somebody is coming at you, stuffing food down your mouth, you want to go like that. You want to back up and you want to say, hey, I'm not hungry, I don't want any more. And you're overfeeding people on a fairly continuous basis. So if you fix that, you are a fabulous character. I mean, you're solid and you're colorful. Somebody used that word. I think Kay used that word earlier. You know, you're clearly really, really bright. You would have a tremendous amount going for you if you would just get this one thing under control about your incessant chatter.
That seems more like a feeling statement from you to say you never do. It's not the literal truth, because you have gotten a few pieces of good feedback, especially at that time when you cried about something
mother.
to do with the death of your mother.
Yeah.
You really showed feelings, and you did get some positive feedback, I think from myself included. And if I didn't say it out, I will say that was very good work.
That really is very good work on your part, Walter, to give us an accurate calibration of reality.
It's interesting now, too, because I'm feeling just a small swell of tears coming up, little bits. And I do that. I haven't done that here in this group.
Because of what I said? Because I complimented you, or for another reason?
No, I think it was in the process of telling this to Barbara.
So what made you tearful about telling Barbara that?
I'm not sure. Was it my willingness to give something to somebody? I mean, you know, I've been trained as a very good macho boy by a Sicilian father, and his agent, my one older sibling, 5 years older, an ideal age older, I think, to be the good boy and don't cry. And I was desperate for their love after the relationship from my mother. That's been my fantasy about what happened, because I can't really remember all the way back there so well. And it seems like overcoming that has been so difficult. But gradually now, at 65 3/4 years, I do let it happen more. I let the tears come a little more. And now, with the feeling work I did with you last week, I'm ready to say, also in answer to what we talked about just before during your go-around. I'm in 1,000 places right now. I've lost my track. That happens. I'm feeling, I guess, a bit overwhelmed. And
You're doing
would
great.
you help me?
You're doing great. You don't need help. Thoughts fly out of our minds. Then they dissipate into the air. There's no problem with that.
something I wanted to answer to you.
Well, it'll come back.
All right, I guess I have to let it go then.
Jane, I have to say, I was angry at you when you, or a little disappointed when you kind of attacked Dee for sticking up for me in certain things. And Dee's not an idiot. And I'm defending him now because I think if anybody's gotten to know me very well in this group, other than Kay and I have gotten to know each other a little more, Dee definitely had my number, not literally figure, I mean, from day one, because I think he has a lot of empathy, and I think we just clicked. I mean, I'm not going to click with everybody. Like I said, people do either love me a hell of a lot or despise me. So that's just been the way I've been since I came out of the womb, okay? So I felt really betrayed because you looked at it as being a deficiency in his part because he was loyal to me. I haven't had a bad thing to say about him either. I don't have
She
anything.
just meant, Barbara, that sometimes I can see, and I can see it too. So you'll see this actually in a lot of parent-child relationships. You know, the parents that no matter what their kid does, they can do no wrong. You know, no matter how they mess up or if they're a bully, the parent will not accept anything. So that's the kind of behavior I
But
think
he's
she's
actually
talking
said
about
things
with
to
Dee.
me, but he's done it in a
And
very
it could
gentle
be,
way.
yeah, but not just with you. What if he does it in a relationship where, you know what I mean, you're supposed to have the pull and the give and the take and the, you know, the negative and the positive mixed in there. That could be deterrent for him.
But I don't always sugarcoat it with her. I mean, even today, I told her a couple of times that, you know.
No, but there's a way you talk to me that you don't talk to other people. And you're gentle with me. You're not
angry.
You're not in my face
You don't
like
get
you are with
irritated.
other people.
Which is okay.
I want to address your use of the word attack. As an analyst, one might call it attack. I'm attacking, if you want to use that word, the characterological blocks of my patients, but I'm not attacking the patient. I'm going at the unresolved issues, and
I didn't feel it.
I didn't think you felt attacked.
I just felt
and
very...
it wasn't an attack.
But I just felt like, God, the one person here that and Carol, you know, I mean, the two people in the room that I've had a good rapport with. from the
But
very
Barbara, you're
beginning,
not
it's almost
understanding. It's not about you. This issue that I brought up with Dee was something that I noticed about who he is and how he's functioned in this room. It's about him. It has
But
nothing.
functioning with me.
It has
Oh,
nothing
with
to do with
everybody.
you.
Well, you mentioned my
She took
name.
it personally.
No, you mentioned my name. I mean, so.
But you've got to understand. We are not talking about you. We're talking about Dee.
I don't know. I give up. Like, I mean, it's like I'm trying to make a point, but you know, it's just.
But I
people
know her, and
see-
I know how she would take it personally, because it totally negates in her mind anything that I've done that wasn't genuine then to her.
But I am
No, I don't doubt
asking.
that at
I am
all.
asking for people to come to consciousness about their functioning, which in fact is a change. So in a sense, I'm asking for a change. I'm not asking you to change who you are. I'm asking you to be aware of who you are. So I am asking
Mm-hmm.
of Barbara that she understand that I'm talking to you about you.
Right.
I noticed it most strongly in your relationship with Barbara, but you know,
Well,
I could
yeah,
have
I
noticed it in
mean-
relation to
Right.
someone else.
Right.
And then when you came to me and you said, "Oh, yeah, you talk a lot." It's like, duh. Yeah, I know that, and I'd be the first.
No, I didn't
to-
say you talk a lot. I said you talk too much and you use
that's the
it.
same thing.
And you, no. A lot is different than too much. And that you use it as a way of warding off people. And that's a really important insight for you to have, if you could have it.
Yeah, but then
Because you
can't-
want to know why it is that you've gotten such negative feedback
Because
in
I'm
this
very
room.
honest, I think,
No,
too.
it's not because you're honest. It's because of what I'm telling you.
Well, we had this conversation last week with her. This is the same thing we're talking.
Yeah.
She's talking about the same thing we talked about last week.
Yes, we'll probably talk about it. If we go on for another 10 years, we'll still be talking about it.
Oh, thanks a
No,
lot.
maybe not.
So,
No, maybe
so
not.
I'm never going to improve.
get-
That's what
get-
You
she's.
are improving.
Well,
No, that's
show
a
me
s-
improvement.
No,
Not-
I don't
very
think it's going to be
hard.
10
You
years.
think
You
it's
hear
that
me, Barbara?
easy?
I don't think it's going to be 10 years. I think it might take a few years, but you
How about-
can improve.
But 54?
Less than 10.
How about
Less than 10.
Hey.
Maybe 1 or 2.
Hey, how about
Good.
right now? How about not waiting a few years? How about right now? How about for the rest of the group, just process
go
what's
ahead.
happening in the room and talk strategically. Talk when you have something to say to somebody that's going to be meaningful, as opposed to just saying whatever it is that you're thinking and feeling and spewing it out.
I've said meaningful things in this show.
You've said many,
I mean,
many.
to Carol,
You've said many
to
meaningful
you.
things, and I'm suggesting that everything that you say be meaningful.
you.
I think
Not-
that would be extremely difficult for her, but she
Yes.
could probably make some progress at doing it.
But listen, is
Walter
this?
just showed a lot of progress. By the way, Walter,
I
I'm
agree.
sorry we got off on another track right away. I just wanted to say to you, I was very touched at your honesty and the place that you went just a little while ago. So I thought that was a good thing.
Resistance. You know, you're new to me, and my
You're
urge.
welcome, Walter.
He heard you. He heard you. He's just being sincere.
Go ahead.
I heard you.
Okay.
I'm so inclined with a fight back reflex that it took me a while to see that though what you do with feelings is not like the way I've learned to work with primal feelings. You know, in a primal therapy context, there's still some value in it, and I did it last week, and I'm glad, and I feel like more like cooperating now. And in the same sequence now, since last week, coming into today's session, I also came across another feeling. I really felt my fucking anger at you for being the
God.
authoritarian that you are. And I've just felt it as too controlling. And I don't know how accurate that is, but I felt it at you. There's probably some validity to it. I felt it. I felt the anger, you know. That's,
If
that's
it makes
what I
you
felt.
feel better, Walter, I've kind of felt a lot of rejection and anger at Jane too at certain points of this group because
That's pretty normal.
I, like Regan, also like to feel the love, and I love Carol, but Carol's been the teacher's pet in this group. And no, I mean, you know, with all due respect, and I think it's great that you were able to reach that, and we all would like to be you right
What happened to
now.
Lana?
For those of us who are being,
Well,
yeah, she missed Lana.
Well, what just happened here, you guys? I need some feedback because I really reached out to compliment him.
He
and
did.
he
And he
went
totally-
wham.
yeah,
he
he
couldn't even
totally-
say thank you
right,
and move on.
yeah, I
he
know.
like went slap and
Yeah.
moved on. So
Yeah.
tell me what
He
that
was
is
afraid
accurate.
that he was going to forget what he wanted to say again, I think.
So he could. So a quick thank
That's
you.
right.
The thought.
A quick thank you wouldn't have been
took a
would
lot.
make him forget.
Yeah, it took a lot for you to say that, actually,
I
given
guess
your reaction.
Yeah, I think it took a lot. Thank you, Barbara.
But I
think
also
that's a-
don't agree with what Jane said about you and me, that you know, our reaction at the time that he was yelling was a primal
I'm
reaction.
just going back to just now. This is the one I'm having. Would like some feedback from.
But
I still
Now-
have
But you're not going to get it.
Can,
you can't
can you
force it.
thank me?
Can
Can
I-
you say thank you
can-
now, or is that
can-
going to be a big issue for you?
Let me tell you
there we go.
exactly what comes up. I still have a feeling sense of you next to me, giving to me, and I like it.
So
It's
can you
like
say
I
thank you?
Can say the words come. I appreciate it.
But not thank you. Because I want to hear thank you.
She actually
Those are
said
the
a
words
lot,
you don't want to say
Walter.
because I want to hear them.
Walter, she said a
That-
lot.
Right?
That might be so. If I
Okay?
go,
This
if I-
is what
if
it's
I go
about
in my
cooperation.
head, if-
This is what cooperation. I want
Walter,
to hear
say
thank you.
thank
He
you.
want to say I appreciate
Say
it.
thank you if
Okay,
you
I
feel
hear
it.
thank you. I'm
Yeah.
hearing
It
thank you.
took a lot
Okay.
for you to
I
say
accept
that,
That's
Jane.
fine, Walter. I appreciate it.
It took
That's
her a
fine.
lot to say that,
There-
Walter.
okay.
There was a resistance to saying the words thank you, but
Because I wanted them.
But I don't know. I don't know. I
Oh.
can't feel it. I can't feel that.
She
it's
paid you a
because
compliment.
You wanted them. I don't know what I feel. I do know I felt like saying the words.
Thank you. I appreciate it. That's
appreciate.
good.
I do appreciate you giving to me. And
Walter.
Well, that's
I
very
guess-
nice
yes,
to say.
I was
Barbara,
afraid.
Barbara.
I was afraid of losing what I wanted to say to Jane.
That's what she said.
I want, when they're doing
thank you
their
for,
work together, I want you to
bringing it up.
let them do it.
For
As opposed to
trying to
trying
stick up for her.
as opposed, no, I don't want you to stick up for anyone. I want you to let people process in the way they need to
In the words,
process.
hey.
You went from a serial killer to a friend in like one session.
And you're trying to get that
You
friend
don't
back.
think group therapy works, right? Okay.
So Shanti, can I invite you? to
do
join us verbally somehow?
Yeah, you can invite me. Thank you.
But you don't want to respond verbally?
Not yet.
Okay.
But believe me, I'm not shy.
Okay.
Honestly.
Okay. Well, if you don't say anything,
I'm taking it all in. I just gotta. I have to integrate it, digest it a little bit. Usually, I'm not this way, as you may well know, or hardly know. But at any rate, I'm not shy.
yeah. Okay, but if you don't talk for the next, I don't know, 10, 15 minutes, I'll probably check in again. If
Okay,
that's okay.
fine. I'm not going anywhere. I'm going into my seat.
I appreciate how genuine this guy is, Walter. I mean, he can't say something unless he really feels it.
Yeah.
Did you see? I came to
That's
thank you.
amazing.
You can,
That's
though,
pretty
right?
cool. Oh, I can. Yeah.
I came to thank you.
You can say stuff you don't even mean,
Well,
Oh, come on.
Not
That's not
necessarily.
fair.
but you don't have to feel it so.
yeah. I mean, this dude has to feel it to his core. He has to feel
I've
it to his
seen you
core.
get angry, though. I've seen
I
you.
do.
I've seen you get really pissed.
But I admire that.
So, did you like being called Teacher's Pet?
No,
I didn't think so.
Well, he-
that's
Oh, yeah.
embarrassing and it's unnecessary and it doesn't.
Well, she does treat you better than the rest of the group.
I
mean,
disagree. I think that.
She
I
said
don't
she
even know what I
loved you.
think.
She actually said she loved you. She will never say that to me.
She has
I can
said
guarantee
that, I
you.
think.
Monica wants to hear that you love her.
I have Regan's issues now. It's been transferred to me now. I don't feel the love. I need to feel loved and needed. You know?
Every time you cooperate with me, I love you.
I feel like a dog. I think your dog needs the bone, you know? I'm going to reward
Did you hear what she just said?
Yeah, I heard her.
What did she say?
If I cooperate,
Not if you cooperate.
Or when
I
Every time you
cooperate-
choose to
choose to
cooperate.
cooperate,
She didn't
she
make
loves
it
me.
that way.
so how many times have you loved me? Joan, I don't even know who I'm talking to anymore.
Okay, so I'm not loving you right now because Carol kind of had the floor and she was trying to do something, and now you're taking over. So I would love you if you would help Carol.
I love her for taking over. I didn't really know what to say. I just, nobody likes to be told you're the pet or you get treated better or anything like that. I don't like it. I was accused of that growing up. My older sister said, you're the pet, you're the baby of the family. I was the baby of the family, but I didn't feel like I had any special treatment. We were still, my parents couldn't afford lessons I wanted and stuff, I don't know.
So we're pretty much at the end. So I said I was going to check in with you, Shanti, again, so I'm checking in before we end.
Oh, I'm fine, thanks.
You're good. Okay.
This woman has a great aura.
She has a good aura. Well, we're going to learn more about her. Okay. Thank you.